So what are you doing in the week before your NCLEX and what are you doing on test day? Let's run through part 2 of testing anxiety where I break down what I recommend to my NCLEX students. Okay, so if you are 1 week out from your NCLEX, you need to take a practice exam because you need to see where are you at. You need to identify your weaknesses and your strengths and cater your study plan that week towards your weaknesses. Remember, you're never going to know everything for your NCLEX. This is all the information that you have covered throughout your nursing student journey, okay? And that's always a really hard pill for people to swallow because everybody wants to make sure that they know everything and they're prepared and they covered everything. But unfortunately, for this exam, that is not the case. So what you want to do is take that test and focus on your weakest areas. So if you scored really poorly in pharmacology, you're going to cater one day to pharmacology. If you scored really well in, let's say, cardiology, then you're just going to refresh and review your rationales from the past, but you're not going to really spend any new time focusing on that subject. So a week before you're taking a practice test, then I typically recommend that you take 1 to 2 more throughout that week just to see how are you progressing. Are your weak areas still staying weak? Are your strong areas still staying strong, okay? And you cater as you go. Now, what are you going to do the day before your test? And I'll tell you that I am a perfect example of somebody who says, I'm still going to study. But I recently took my exit exams for my nurse practitioner program, and I was studying for hours a day. And not necessarily consistent hours, but it was my main job at that time. So what did I do is the day before I said I'm going to take a practice test. I did terrible on the practice test. Not because I didn't know the content when I reviewed the questions, but because I was exhausted. So when they tell you don't do anything before the exam day, don't do anything before the exam day. I immediately shut my computer, I went for a walk, I laid down, I watched TV, and I relaxed because your brain is a muscle and it needs its rest too. You need to be fresh and clear. Now, day of the exam, morning of, I want you to stay away from people who maybe give you some anxiety. These people don't do it intentionally, but sometimes when you start talking to others who are also preparing for that exam, they'll start talking about content that they reviewed. You might not have reviewed it. They might have reviewed it. You're working yourself up because you're like, man, do I know as much as they do? And this just might give you some more added anxiety. So typically what I do is I only really text my parents, my boyfriend, and I don't really talk to anybody. I put on a playlist and I drive to the test. And last thing here, during the exam, I want you to practice mindfulness. Do deep breathing. Don't let the anxiety overwhelm you that is blurring your knowledge and your ability to understand the question. Now, I know this is extremely hard, but start practicing during your practice exams, start practicing during your practice questions, because at that point, you're already there, you're in the test. You've done everything that you can to prepare yourself. There is no looking back. So take a deep breath and try to have a clear mind so that you don't get distracted by the distractors and you stay knowledge focused. Okay, I hope you learned something from this. Please comment and let me know if you use any other strategies for testing anxiety, and follow for more.